Now let's delve into health matters. The Nigeria Center for Disease Control, NCDC, has again warned of a possible fifth wave of the COVID-19 virus in the country, given the resurgence in the number of confirmed cases. It disclosed that about 1,332 cases were recorded in 1 week. As of July 22, 2022, Nigeria recorded no fewer than 260,339 confirmed cases, while 253,566 cases have been successfully discharged. 3,147 lost their lives to complications arising from the virus. In India recorded a total of 20,279 new coronavirus cases in the last 24 hours, bringing the country's overall COVID tally to 4,388,755. Many parts of Canada are experiencing a sharp increase in COVID-19 cases this summer. And also the United States is not left out, as it has reported over 90 million cases and over 1 million deaths. With President Joe Biden also being infected with the BA.5 Omicron subvariant of COVID-19, which is said to be the most dominant strain in the United States. Now, experts are calling for tighter COVID-19 measures as global infections caused by infectious Omicron subvariants continue to rise. Now, let's further discuss this with Dr. Akoni Abiola, a medical director at Olukayode Clinic. He joins us virtually. Thank you so much for joining us, Dr. Akoni.
Thank you. Thank you. Good morning, everyone.
Should this begin to raise fears, considering the fact that there are talks about another wave, the fifth wave of COVID-19 virus?
The language to create fear is just is an awareness that luckily you've been aware, and the breakout of this virus has been there for the stage 1, stage 2, stage 3, and so far we are expecting that if it happens, we already indirectly have immune system towards this virus, and luckily government and the federal government and even the outside country have created a vaccine that everybody is accessible to have a vaccine towards this COVID virus, and even if the other virus that comes in. It's just for us to prepare our mind and be not relaxed enough to take care of any exposure to pollution, outbreak of air or polluted environment, and avoid overcrowded environment, and try to restrict any activities that involve the numbers of people, and our visitation should be indirectly be scheduled and restricted to certain area, and interstate traveling or people that come from international level. The procedure, the screening have to be strictly by professional experts to know that we are not exposed to this virus, or we don't give any lapses or any way like people can just bring in any virus that is not well controlled in their country or expose people to it. Because if we have 2 or 3 people coming from international level to the airports and exposed to the airport workers exposed to this virus, from that point of contact, it's exposed to people at home, from there, markets, hospitals, churches, mosques. That's why this is spread everywhere on that. That's why we need to be careful, and we need to be aware that even the COVID virus is not completely 100% off from our environment. And this cold weather, this winter weather is just that makes this virus to stay longer on the air. That means it exposes people to it, especially the elderly one, or people that have medical disorder, history of medical disorder, or people that have been on management of health issues, people like diabetes, hypertension, cancer, or immunodeficiency disorder in the body. That's why we have to be very careful. We have to try to maintain our strict management to control or reduce virus exposure to people around us.
Yeah, but okay, go ahead.
Well, Dr. Abiola.
Yes.
Okay, my question is this. The Omicron subvariant that is the dominant strain in the United States and, is going around at this point in time. How resistant is it now to the vaccines? We've heard of reports that those who have been vaccinated before have, been infected by this subvariant of Omicron, and they're finding it difficult to fight it. So how resistant is it to, those who have received probably their double jabs but yet to receive the booster shot?
Yes.
Okay.
Yeah, thank you. Thank you. What happened is that the awareness to the vaccine was known to us that even if you take the vaccine, you can be infected. Even if you've been infected before, it's possible to be infected again by this virus. Meaning that what the vaccine is all to do is just to boost your immune system for the duration, the window period of this virus in your body system. If you have the vaccine, the window period, your body can be able to withstand the window period of this virus in your system. It helps you to fight it, and you probably to get away from the symptoms. But by the time you take your first dose, second dose, and the booster dose, those people have the opportunity and body immune system to fight it more than people that probably take the first dose, or people have not even have opportunity having the first dose.
At all.
The vaccine is just at all. The vaccine is just to build our immune system towards this virus if mistakenly we are exposed to it. And by the time we are in the window period or the exposure period, the contact, the body can be able to fight it, especially people that have underlying issue of medical history, a chronic management of some clinical disorders that has been managed for years. These people are prone to have breakdown to this low immune system of this virus, because the virus fights the immune system, and immediately the immune system is down, that person will be unable to withstand the symptoms or the opportunistic crisis that comes in from that complication of that virus. That's why it's advisable that if you've taken the first jab, the second, and you should take your booster dose and make it there. And the primary health team should make availability of this virus for everybody, just to prepare us towards the another outbreak of this Omicron as we are hearing that is coming around, because we can't 100% said we will be out of it, because we have people that move in, move out from the country on daily basis, and even the workers, even the people there that is exposed to one or two, they have contacts, and from there, that's how this thing move from one place to another.
Okay, doctor, for those who have taken their booster shots but are dealing with pre-existing medical conditions, if they get infected with the sub-variant of Omicron, do they need to get another shot?
No, when it comes to COVID, COVID just come in like a sudden visitor to every country, everybody, because of the virus. Okay. Is that the research is still continue, and more information is still continue on daily basis to know how we can get rid of this virus completely from our system and to reduce the death rate of this exposure to this. Is that if most people that have been on medical management for months or for years, it's possible may be exposed to this virus. It's better, prevention is better than cure. It's better than keep indoor or restrict exposure to certain area or certain people for them to reduce the contact spread of this virus. That's the best thing for them, because as well as anybody above 60 and is under medical management or under certain drugs should probably stay indoor and then make them warm, make their lungs warm, at least they should do follow up on their medicals.
Yeah, but doctor, there are reports that this variant has mutated in terms of symptoms, signs and symptoms. Talk to us about these variations and mutations in the signs and symptoms.
No, the signs and symptoms is various individual. That's why it depends on the individual background or medical history. People that have diabetes for a long time, the symptoms or the signs they may feel may be different from people that have high blood pressure or somebody that have immune deficiency disorder before. That means it varies, but the major thing is that this constant uncontrolled temperature, the temperature going up, some coughing, some sneezing, some high blood pressure, some finding it difficult to breathe, like an asthmatic crisis. Those are the common symptoms. And some have maybe like an allergy, probably skin reactions, all those things like that. It now depends on individual. But the common is uncontrolled body temperature that goes above 38 points
5.
High, yes, above that level high, and having this feverish feelings or sweating at the same time, cold at the same time, or even it results to people having kind of partial stroke, all those things. Depends on individual and how this contact, the exposure to it, and the window period, how the body fight it.
But are we looking at new restrictions coming up? Because you talked about the fact that this virus spreads via movement, especially for those who are moving in and out of the country. Are we looking at new restrictions?
It's possible if the rate of the spread is down, if it's coming alarming, we don't have choice than to probably add to the normal restriction we have, is that nose masks, try to use our sanitizer, try to reduce it, maybe a kind of party, club, but we are still trying to check what is it. But luckily, so far, at least, we can say maybe 40% has taken their first jab or second jab on the immunization to the vaccine. It's possible. Most people may be standing, but the only advice I'll give is that let's try that anybody that has symptoms of malaria, let's don't allow our malaria to stay long in our body, because if you have a malaria symptoms, it breaks down your immune system. And on the traces of having malaria symptoms or signs, and you're exposed to this virus, it may be deadly, it may be a kind of alarming. It's better we don't allow our malaria to stay longer before we get a proper treatment of malaria. And if you have anybody that's having this constant, persistent cough, uncontrollable, we should be able to try to get a proper management and treatment and as early as possible. And we try to make the children to avoid exposure to cold or gathering. And I think we should try to restrict gathering, party, or staying under the same roof for a number of people. You have to be careful. It's better we still maintain that restriction. At least it's better than having the number of breakdown or exposure to it. That's the best advice.
Okay. But how do you encourage vaccination? How do you encourage people to take the vaccines, seeing that the vaccine does not stop you from getting infected?
Yes, thank you. That's a good question. What I tell my patients and what I want people to understand is that in some case, when we're talking about vaccine immunization, every mother in every home now, every child birth, we have an infant in every primary health center or teaching hospital or even private facilities. It's a norm now that every child has to pass through a immunization of polio vaccine, TB vaccine, as oral polio, all this vaccine, measles, chickenpox, meaning that this vaccine was discovered one day, and it was presented to us that it's advisable for every child that was delivered in a urban area should take immunization, and then we have what we call immunization card. Now the COVID vaccine too has been developed. It's still the same way we are being presented to take our normal polio, measles, chickenpox, and TB that we've been taking for every child. I can tell you every child we have in Lagos, we have everywhere now in Nigeria, has what we call immunization card. That's vaccine card. For them to take that and we are not dying, and for them to prevent the body, it's just to build the body immune system towards this. If mistakenly exposed to, is not a certificate or an 100% that this person will not expose to you or this person will not have the symptoms. But to help you that when you have it, you can probably pass through the window period and be free from the deadly crisis of this virus. In the same way, the COVID vaccine is being developed when we have outbreak of it. Now, given to everybody, and now we've not had any pronounced negativity about the vaccine. That is just to build it's like taking a supplement, a builder just to build your immune system towards certain things. It's better than leaving your body alone, now exposing to it and now regretting that why did I take it. And we can see when COVID outbreak came in, you can see the number of elderly people that passed through this crisis. Because people died silently. Some people even died indoor from keeping themselves. Yes, because you can't get the statistics and the numbers of these things. We lost a numbers of elderly people, the intelligent, the professors, doctors, medical experts on this COVID crisis in different ways. I mean, it's better if there's a prevention that can give us 50-60% preventive measure. Yes, it's better we do that at least to save people's life and to keep our life safe.
Okay, Dr. Abiola, earlier when you were speaking, you said the weather is playing a part in how, the subvariant of Omicron is spreading rapidly across the globe.
Yes.
I know you've given tips earlier on how to prevent it, but I'm more concerned about the weather because, it's difficult to tell when the rains will come because of the season. So, what are the measures that you would advise as a medical expert that people should take to ensure that during this weather, they are not, vulnerable to being infected, for the virus?
Yes. The most important thing is that we should try to keep ourselves, especially the elderly ones, the old age group, to keep ourselves warm, to eat warm food, and try to be on, everybody have a kind of method or procedure when the COVID was alarming. Everybody is taking vitamin C, these fruits juice, fruit process. It's just for us to eat a good balanced diet, take a lot of water, and keep ourselves warm. Okay. It's better we keep ourselves warm and exposing ourselves to cold, because this cold weather is not about virus alone. We have the alarming rate of our elderly people having rheumatoid arthritis, rheumatism, having this breakdown of joint pain, cartilage, pains in the joints, pains in the waist for the mothers, for the adults. It's better when you keep yourself warm, there will be free blood circulation, there will be free movement of these, the muscles, the neurons in the body. It helps them to perform well than having clotted blood or clot thrombosis within the bloodstream. It's better we keep ourselves warm and try to take the precaution of the COVID vaccine precautions by using sanitizer, trying to restrict outing, going to a wide gathering, and trying to use our face masks. That is it, nose masks, and those are the precautions. It's better to keep ourselves warm, and if possible, eat, for people that doesn't have ulcer, eat pepperish food or supplements. Let our food have a kind of pepperish food that makes us to sweat more and kill any germs within the trachea, within the lungs, and if you can sweat it out. Okay. And some people do steam inhalation, like losing this steam, facing themselves. It depends. Everybody have different methods, but the best thing is to keep ourselves warm, to be restricted for exposure to people that have interstate, maybe traveling or coming in newly. Try to reduce our contacts with people like that. That's the best advice.
So generally, is Nigeria ready to tackle this fifth wave, considering the fact that over 1,000 cases were recorded in a week, and we know that yes, the past waves have been there have been talks about the nation not being proactive enough. Are we ready to tackle this fifth wave? And you know that this over 1,000 cases are just maybe a conservative number, considering the fact that they are not well reported, and the fact that there is not enough testing done in the country.
Yes, it's only when you don't have the problem, that's how the solution will not come. We can't even believe that Nigerians can even do the best, excellent delivery at the government, the health team, for the COVID vaccine that happened, and for the shutdown of everything that's happened in all the states. Meaning that we don't pray for the outbreak to get to the country, but if willing, God willing, and at the end of the day you find out, Nigerians the medical team they are ready to face the challenges, and we are ready to prepare everybody, and that is why the importance of this awareness is very important in every home, to know that prevention is better than cure, that everybody should prepare and restrict going outside the country or welcoming people outside the country, to be careful on where you go and the contact. And from our airports, there should be a standing order that anybody that is coming in should be able to pass through the maybe COVID vaccine or Omicron vaccine, to know if this person is exposed to it, or there's a number of days they have to take before exposing themselves to the community, the area they are. Is very, very important, because when you take this
preventive steps,
restriction, it helps a lot, and it saves more money and it saves life.
Well, you've just painted the ideal situation, but the question is the government of the day taking these steps to ensure that Nigerians are protected?
Yes, they are. Yes, sure. They are. They don't have anything that to take of the humanity and the, when we talk about X team, it goes to the medical team. They are ready to face the challenges, and the more the information is going every day, and with the experience we had at the past crisis, we should be able to say, this is what we can do, this is what we can stand in for.
All right.
God willing, yes.
Do we have, just as we wrap up this conversation, Doctor, do we have quarantine camps at various airports wherein immigrants, have to spend 14 days, in such camps with medical personnel, undergoing several tests just to ensure that they are free from the virus, that way protecting the people? Do we have those measures in place?
Yes, for every standard, the international airport should have that measure. And in general,
again, you're painting the ideal situation again.
The problem we have in this country is corruption. During the process of COVID vaccine, we have people, even the staff in the airport, that they are forming fake COVID vaccine results for people to travel. By the time the government is trying their own, and the individual are trying to make money or creating more crisis, not knowing that we are killing ourselves, not killing the government, because there's a standard law and there is standing order for all this procedure. But by the time every individual are eager to move out from the country, or they have an appointment, they don't want to miss the appointment, trying to pass the back door to travel, or someone will give you a back reason just for the reason of for them to leave Jordan. From there, exposing people in the plane, the numbers in the plane to this virus, at the end of the day, the precautions or the preventive measure will not be as positive as expected. That's why God to just help us, and we should be able to God should save us from this one, because the corruption level we have in the country has damaged so many stages in this country.
Thank you so much for your thoughts. We do hope that we go beyond the level of praying to actually acting, because yes, you've painted the ideal situation, but we have moved from.
It's for Nigerians to understand that we should not put corruption in everything we are doing. Those the passengers that are traveling.
All right, we'll just leave the conversation there and hope that all these ideal scenarios that Dr. Akoni has painted would actually be the reality of the day. Dr. Akoni Abiola, Medical Director, Olukayede Clinic, joining us there, talking about the resurgence of the fifth wave of COVID-19 in Nigeria. We'll take a break now. When we come back, we'll talk money. Don't go anywhere.